More and more people are being detained in hospital and on community treatment orders.
See, the nurse said to me that I'll end up on a section, and I didn't even know what that meant.
I can't leave. And the medication that I take, I don't know what effect it's having on me, and I just don't know what to do.
I'm feeling like I don't have freedom in my own home. And I don't know what my rights are.
Independent Mental Health Advocacy, or IMHA, is a specific safeguard under the Mental Health Act.
Put simply, advocacy is a must-do.
It's a statutory right for service users to have access to an IMHA whenever they arrive on a ward for inpatient treatment or offered treatment in the community under a community treatment order. A service user has the right to access an IMHA. They should be given information by a nurse on how to access the service.
It's important for the service users to know that there are independent people who can look objectively at their situation and not judge them and not make assumptions about them, but they're there to support them and to get their voice heard.
The essence of our job is to have a meaningful dialogue with our service users. Some service users may not have English as a first language, they may have a learning disability, they may be very unwell. You know, it's fantastic from my point of view that an advocate helps the staff have a dialogue with the patient. So we should always see that as a huge opportunity, as a huge benefit.
Service users value being listened to. Respectful listening and cooperative relations will result in better outcomes.
An advocate can help service users feel less confused, alone, frustrated and angry.
This can make a positive difference to relations with care teams. Their input can open up meaningful channels of communication and can help service users understand their care and treatment decisions.
When an advocate listens to you and is there to support you, just being in a meeting, just being there is support itself.
You might tell the advocate something more personally you wouldn't tell a doctor or nurse.
What can staff do to help?
It's important for the IMHA when they come onto the ward or when they're seeing the service users to have some privacy to speak to that person. There should be little interview rooms available.
It's very important for staff to work collaboratively with the IMHA, who at the end of the day isn't making decisions on behalf of the service user, but trying to represent those opinions and choices. Sometimes they may be exactly the same perspectives as the multidisciplinary team, and other times there may be a difference of opinions, and it would be important to discuss those differences of opinions and try and find a way forward that's most useful to the service user. It is a statutory right now for patients to be able to access their clinical notes via the IMHA. It's obviously very important for staff to realise that.
They are independent. In some circumstances, an advocate, for instance, may not want to come into the office and sit and chat to staff and joke and chat in the office because the patient will be looking through the window. So I think it's so important for the advocate to be kind of neutral, to be independent.
Some practical ways to support advocacy include
making referrals, raising awareness, involving service users and advocates in decision making, and informing the commissioning of inclusive services.
Most of all, staff can help by developing positive working relationships with IMHAs that take care to preserve independence, because service users have the right to be heard.